So let's dive into this conversation. It is about talking today, and we are talking about mental health. And we cannot ignore also mental health in the workplace, which is where we are going to begin today. And Prime Minister, the workplace report of the former Governor General Julie Payette's office, this is what Canada's been talking about, full of some troubling allegations about what some employees described as a toxic environment. The question we have for you is, how do you think Canadian workers feel about the way this has been handled?
I think obviously it's difficult to hear. Everyone deserves to be in a safe workplace wherever they work, whether they work for the government or the GG or any workplace across the country. Last summer, we heard disturbing allegations in the media about certain concerns that employees shared. We launched an independent professional investigation review of that workplace right away to give people an opportunity to share their stories and share their perspectives. And then the report came back about a week ago, and the Governor General made the decision to step down. I think it really emphasizes how it's really important that everyone have a safe workplace, whatever work they're doing.
Mr. Prime Minister, would you have handled anything any differently?
No, I think it's important that proper processes be followed. I mean, certain people are perhaps saying that as soon as there were allegations out last summer, action needed to be taken. Yes, action needed to be taken. And that meant turning to a professional, independent agency to do a review of the workplace to see what was actually going on and to make sure there was an actual process in this. That's I think what everyone expects, that they be listened to, that they be heard, that their concerns be taken into account, and that steps forward be made. But obviously, different steps will be right for different places. But this one was one we took very, very seriously because it's such an important office.
Let's move on to mental health care access. We know that there are wonderful free resources available increasingly out there online and beyond. There's also certain workplaces that have coverage for private therapy. But there are some advocates who say that that's still not enough for sustained support who all need it. So what's preventing Canada from expanding universal mental health care?
That's a really great question. And it's something that we knew when we first got elected 5 years ago that we needed to move on. So we actually put forward about $5 billion to the provinces to increase mental health options and services. Now, during the pandemic, we're doing a lot more. We funded Kids Help Phone because they're getting about 1,000 messages and phone calls a day from kids across the country. So we gave them more money. We also created a wellness together portal on government.canada.gc.ca that is providing resources. But you're absolutely right that our healthcare system hasn't yet caught up with the destigmatization and the amount of people who are willing to put up their hand and say, I need help, I need to talk, and we have to do a lot more on that.
Mr. Prime Minister, you mentioned the pandemic. After the SARS pandemic, 60% of people who were directly affected said that they still experience mental health symptoms after a year. And experts are saying after this current pandemic, there is a possibility that those delayed impacts could arise. So is there a plan in place for what could be an imminent mental health crisis?
Well, I think we're already in a mental health crisis. People are stressed. People are anxious. People are isolated. People are tired of the pandemic, of having to be limited on everything. It is grinding everyone down. There's no question about it. So we're trying to support and encourage people to be there for each other because that's how we get through this. But obviously, afterwards, there are going to be long-term impacts on our communities, on our families, on individuals that we're going to have to really be thoughtful about. Once we get vaccines, once we get back to sort of normal life, whatever that is, there's still going to be a whole bunch of echoes and scars from this pandemic that we're going to have to really stay focused on.
Mr. Prime Minister, later in the show, we're airing an important conversation we had with the director of a mental health center serving the Mi'kmaq population in Nova Scotia. And she told us that a lack of government funding is, bar none, the biggest barrier preventing people in her community from accessing care, funding she describes as having to beg for. So what would you say to her?
I'd say I absolutely agree. We need more funding, more resources for Indigenous communities, for remote communities, and in general for Canadians right across the country. The federal government has an important responsibility on delivering healthcare services for Indigenous communities, and we have stepped up massively with millions more dollars, tens of millions more dollars for different communities. But there is absolutely more to do, and we're working on doing it. But we can't just do it alone. We have to do it in partnership with them, which is why I'm so pleased with all that work being done.
Now, a report from Decent Work and Health Network revealed that 70% of low-wage workers in Canada don't have paid sick days to take when they're not feeling physically or mentally well. And annual sick days, of course, a couple of provinces do have them. But your government introduced the Canada Recovery Sickness Benefit that offers $500 a week with some stipulations, so that's fantastic. But would your government consider increasing that amount or perhaps expanding the benefit beyond the pandemic?
I think there's a lot of things that we've done during this pandemic because we had to work really fast to be there for people, that I think it would make sense to think about how even beyond this pandemic, we keep filling in these gaps and these cracks we've seen in our system, in our social safety nets. Sick leave is certainly part of it, and we're happy to work with the provinces on it. I mean, one of the challenges is sick leave is very much more of a provincial labor responsibility. The federal government was happy to step in, and we've stepped in for about 8 or 9 out of every $10 spent to support Canadians in this pandemic was federal money, and that's the way it's supposed to be. We're glad to do that. But as we move forward in the long term, we want to see provinces also step up on improving sick leave and support for vulnerable people. We'll be there as a government, but we respect the Constitution that says, it really is provincial responsibility.
And that's where I want to go next, Prime Minister, because we've seen the work between the federal government and the provincial governments. We've seen you all working together in a way that perhaps we've never seen before, at least in recent history. Is there anything that you're learning about the Canadian healthcare system in this new way that you're navigating between health at a federal level, but of course, as you said, being governed at a provincial level?
Well, I think absolutely. We're learning things every day about how to better serve Canadians, both during the pandemic, but also in general. There's things that we're doing now that we absolutely are going to need to keep doing even once the COVID-19 is gone, or at least fully under control. I think we're really lucky in Canada that even though, yes, we have a prime minister and premiers that disagree on all sorts of different things in terms of ideology, in terms of perspective, that people have worked together, that people have really been aligned across all orders of government to be there for Canadians. We haven't seen the kind of divisions or partisanship that in the United States or elsewhere have really caused challenges. So we're not going to agree on everything, and we still point out where we're falling short to encourage each other to do the best we can for Canadians. But the fact that we've been able to work together, I think, is to the credit of the premiers, but also the credit of all Canadians who have really been very clear that they want people to work together, and that's exactly what we've done.
Speaking of work, the Globe and Mail recently published a series on the power gap, and specifically noting that progress for women in the workplace has stalled by almost every metric. And we know it's a fact that institutionalized inequality affects our mental health and wellness. Women are having to choose between their careers and their families, even more so now during the pandemic. So, Prime Minister, what can be done to minimize this gap?
Well, I think first recognizing that this pandemic hasn't hit everyone equally. It has caused a she-cession. Women, young Canadians, Canadians who are racialized or from vulnerable communities have been higher affected, more affected by the economic impacts of this pandemic, and in many cases by the health impacts of this pandemic. And that requires us to do even more work and to supercharge our efforts that were already underway to create better pay equity, better gender equality. We've lost a lot of ground because of this pandemic, and it's going to be really, really important that our finance minister, the very first female finance minister in the history of this country, my Deputy Prime Minister, Chrystia Freeland, will be working on this with all of us as a government to make sure that the supports we do on restarting and relaunching our economy builds in the fact that gender equality is not just about the nice things to do, making sure we're compensating and countering the intersectionality challenges that exist throughout society is not just the moral thing to do. It's the smart thing to do. It's the way to build a stronger economy and better outcomes for everyone. And that's why we're going to be doing it.
Prime Minister, we want to end with this. According to the CAMH, in any given year, 1 in 5 Canadians experiences a mental health crisis or addiction problem. So you've been really open over the years, coming on our show and talking about how mental illness has struck your family, has touched your family. And I think so many people watching have been touched as well, and they may find themselves in the position of caregiver for a loved one or a family member. So could you just share some wisdom or what you've maybe learned being a caregiver from your own experiences?
The important thing is to keep reaching out, to keep listening, to keep being present, to keep reassuring, to make sure that we're there for each other. Pick up the phone, make a Zoom call, show people that they matter to you, show them that you're listening to them. And take care of yourself as well, knowing that it's really easy to fall into rabbit holes when we're isolated. Take time to go outside as safely as possible and breathe fresh air and try and get some exercise. It's challenging for all of us, but caring for yourself, caring for those who love you requires thoughtful, engaged actions and mindfulness and presence. Those are the things that not only help those people we love and who need it, but they help us as well get through these difficult times.
Yeah, as we say today, every action counts. Prime Minister, thank you so much for joining us on such an important day and for such an important conversation. Thank you.
Always a pleasure to see you all. Take care of yourselves, and thanks for everything you guys are doing.